Hello, my name is Adam Riedel. This is my BSN366 blood administration video. For this video, I'm going to need a few things. First and foremost, I'm going to need a physician's order to give blood to a patient that's going to require a blood transfusion. I'm going to need to do a two-patient identifier, as well as make sure that we have consents that are signed for a blood administration, as well as compatibility and requisition forms. Once we've gotten all of that, we would get the blood delivered to us, and from this point we're still going to need to check a couple boxes, and then we're going to use that with another nurse. So with another nurse, I would be verifying and authenticating the blood type, the RH factor, the client's name, the identification numbers on the blood, the donor number, as well as the expiration date on this as well. Once those have all been verified and authenticated, we can go ahead and begin with the administration of blood. So we'll go ahead and put some gloves on after performing some hand hygiene. We're going to utilize a patient's IV that's already in place, and if they have any questions or concerns, we would be able to appropriately address those at this time. I already have my bag of saline hanging on my IV pole, if you will. It's the best I can do, so forgive me with that. And then I also have a cup inside of my patient's vein that will be able to show dripping. So everything is good in that regard. Okay, so going ahead and getting started. We'll have our blood tubing, and with this tubing I'm going to first and foremost make sure that I'm clamping all of the clamps first, and then I'm going to spike my normal saline and get everything primed and ready . Okay. Cool. So once that is spiked, I will go ahead and I can release this rolling clamp a little, and I'm going to prime the filter chamber, which I hope you guys, I'll be able to show it, but I want to make sure that the entire filter is actually covered with saline, so it's more or less 3/4 full, and I'm also going to want to tap this to make sure that I'm releasing and having any air get out of this chamber as well. So by tapping it and letting it slowly start filling up, extremely slowly. Okay. And then one more little squirt. So the whole chamber is entirely filled. I think you can see that. And then what we'll do is we're going to make sure we prime our tubing as well into this bit here. So I'm going to loosen my roller clamp on this one as well. And then what you would do with this, you would just be throwing this in the trash. So I'm just going to, in this instance, kind of just put it on my floor, which is okay with me. As you can see, it is going, and so I'm going to clamp that for right now. And we're going to go ahead and administer this into my patient's IV. That. So we're connected here, and I have it clamped as of right now, but I'm going to go ahead and get that guy dripping. Okay, and so I'm going to let you see that. Actually, I don't know if you can see it. There you go. You can see that we have the drip is going through. It's kind of slow, but there's that. So now that we have the saline primed and going through the IV, everything is looking okay in that regard. We're going to go ahead and get our blood administered. So I'm actually going to clamp the saline for right now, and then I'm going to hang my bag of blood on my IV pole, which hopefully stays nice. That actually helped. And then I'm going to want to spike my bag of blood. And my roller clamp is clamped down on this portion here. Okay, and once the blood has been spiked, I'm going to want to go ahead and release my clamp and start having that chamber get filled up. You can see the blood going down. Ideally, I would want this a little ahead of, kind of piggybacked. Okay, once this guy fills up a bit, so while I wait for this to go into my patient, I'm also going to want to stay with them for 15 minutes during the beginning of the transfusion, because in the first 15 minutes, that's the most potential time for a hemolytic reaction to occur or an allergic reaction. I want to watch out for signs and symptoms of that happening, that being chills, a rash, vomiting, tachycardia, or things like that. It's very important to make sure that I'm being aware of those potential symptoms, especially within the first 15 minutes, to avoid a potential hemolytic reaction, which is a very dangerous occurrence. So I'm going to just try to keep this going a little bit faster here. Just don't think I have the greatest setup right now for ideal flow rate, and I apologize for that. But it is going down, it is moving down here. Okay, we're almost there. In a perfect world, I would be able to have an IV pole instead of just this, but as well as my patient probably being a little bit lower to the ground in an instance such as this. So for demonstration purposes, this will do just fine. So almost there, and I'll just verify that we're actually in. It's coming. Slowly but surely, it's coming. Just show that we're still not occluded or anything like that. I think you can see that, but as you can see, there is a bit, the blood is starting to come through. As you can see, I hope you can see the difference in colors, but there is red coming through, dripping through the vein right now. It is quite a slow infusion rate, so they might be getting the blood administered for a little bit, but like I said, we will be with them for that first 15 minutes. I think you can see a bit of a red tinge to the reflection in the cup, so I think that's decent verification. And then obviously, if they had any questions, I would make sure I answered those. I'd stay with them for the 15 minutes, and then I would also be documenting the administration of the blood products. Thank you very much.